So, you've made that important decision to get into therapy, and now you need to find a therapist. Finding the right therapist is critical for successful therapy. Your therapist should be someone who's not only skilled and experienced, they should also be able to set you at ease and help you feel comfortable and safe. In this video, I share 20 questions that you can ask in your initial call with a potential therapist that will help you decide whether that person or that therapist is a good match for you. Hi, I'm Dr. Lori Barker. I am a therapist, an educator, and a consultant, and I want to help you improve your mental health and start living your best life. So, 20 questions. That's a lot. Don't get overwhelmed. I've also created a list. You don't have to memorize it. I've created a list of these questions, and I've put the link down in the description below. So you can take that list, you can print it out, or you can save it on your phone, your tablet, on your laptop, and have those questions with you when you have that first conversation with a potential therapist. You also don't have to ask all 20 of the questions. You can answer some of them by reviewing that therapist's online profile that you might find in one of the therapist directories, like on Psychology Today or in Good Therapy, or by going to that therapist's website. So some of the answers to these questions you can find before the call. So you can pick and choose out of the 20 which ones you don't have the answers to yet, and the ones that are most important to you. At the beginning of the call, be sure to give a brief description about why you're calling. Tell that potential therapist what motivated you to seek therapy. Give a brief description of some of the symptoms you're having, or the worries that you have, the things that are challenging you right now. But don't do a trauma dump. It's not that kind of call. Save that for when therapy actually starts. In this call, just give a brief description so that therapist has a bit of an idea about what you're looking for. Think of it like an interview. You are interviewing this therapist for a job, the job of being your therapist. But more than that, this is really about building a relationship and you getting the information you need to know if you could build the kind of strong professional relationship with that therapist that would be most helpful for you. So I've listed these questions in order, going from those that are the most practical, things that you probably want to ask or know, and then gradually getting, a little more abstract or with other types of issues that, interesting questions that you might also want to ask your therapist. So you can go through these questions in order. Again, you don't have to ask all of them. You can pick and choose the ones to meet your needs. So here we go. 20 questions to ask a potential therapist. Number 1, what is your degree? Now, there are lots of different types of therapists, and often the different type of therapist goes along with a different degree. So for example, someone can have a master's degree or they can have a doctoral degree, such as a PhD. Also, with those degrees go different titles. So for example, you could be a clinical psychologist like me, or you could be a counseling psychologist, you could be a marriage and family therapist, a social worker, a licensed professional counselor. So lots of different titles that go with different degrees. You should also ask that person if they are licensed, and if so, what type of license they have. Again, with each of these different titles, there is a different license. So for example, I am a licensed clinical psychologist. But suppose someone is a social worker, so they probably have a master's in social work or an MSW. But then, in order to do therapy, that person probably goes on and gets licensed. And at least in the state of California, in the United States, they would become an LCSW when they get licensed, or a licensed clinical social worker. So again, each of these professions has a different license, and that's a question that you would want to ask. You might also ask, where did they go to school? Where did they get their degree? That might not make a difference to you, so maybe that's a question you don't ask, but for some people that does make a difference, because maybe it's a school you've heard of or a program that you're familiar with. Or if not, Maybe you want to look up that program and learn more about the type of education and training that that therapist got. And then you probably also want to know about how much experience that therapist has. How many years have they been a therapist? Have they been working? You want to ask about if they have any specialties, right? What type of problem or types of problems do they typically work with? How much experience do they have working with people like you who have problems like yours? What populations do they work with the most? And then you also want to ask some practical questions such as, how much do they charge per session? Do they accept your type of insurance, and can you pay for the sessions with your insurance? You might ask things like, how often will we meet? How long will the sessions last? What is a typical session like with you? Will our sessions be online, or will they be in person? You can ask about their approach to therapy. As I mentioned, different therapists have different degrees, different titles, but therapists also use different strategies in doing therapy, and often those strategies are tied to a particular theory. So a lot of times, our technical word for that in the profession is theoretical orientation, right? So if a therapist follows a particular theory in their approach to therapy, we call that their theoretical orientation. You may have heard of some of these. So, for example, you might have heard of CBT or cognitive behavioral therapy. That's a particular approach. Or maybe you've heard about psychodynamic therapy or psychoanalysis, behavioral therapy, solution-focused therapy. All of these are different approaches. And it's okay to ask your therapist if they follow a particular theory or if they have a particular theoretical orientation. You can ask, what can I expect in therapy with you? What is a typical session with you like, right? Like, what will it be like to be online with you or be in the room with you? Will they have particular expectations of you as the client in therapy? Now, here's some fun questions, or at least to me they're fun, ones that I really like. So, for example, you might ask the therapist, what do you think is the key to growth and change in therapy? Don't you like that question? I would love to see the therapist's response or hear the therapist's response when you ask that question. Here's another one. What's one thing you would like all clients to know about therapy? You like that one? And then here's one more. What motivated you to become a therapist? Wouldn't that be nice to know? Like, what's the reason they came into this profession in the first place? So I think that's all 20. I may have snuck in a few more in there, but that should be all 20 of the questions. And remember, you don't have to ask all of them. Some answers you can get by looking at that therapist's online profile on their website, and you can pick and choose the questions that are most important to you. And you can think of other ones. You can ask other questions, but remember, you aren't going to have a lot of time. Most therapists will give a free initial consultation that lasts about 10 to 15 minutes. So you probably don't have time to ask a lot of questions anyway. That's why it will be important to pick the ones that are most important to you. And try not to ask the therapist any really personal questions like, are you married? Do you have kids? Have you ever used drugs? Unless that is directly related to the reason you're seeking therapy. So, for example, if you're seeking substance abuse counseling, you're looking for help with alcohol or some other type of substance abuse, and you would feel most comfortable talking with someone who's also struggled with substance abuse, then ask that question. But remember, it's going to be that therapist's choice about whether or not they're comfortable answering that question. But you absolutely have the right to ask it. Or what if you're seeking help with parenting and you want to ask the therapist, hey, do you have kids, right? You want to know if that therapist can relate to what you're going through. And you want to know if the advice, well, therapists shouldn't directly be giving advice. That's a topic for another video. But if you want to make sure that the help that that therapist is giving you is valid or based on their own experience as well as their professional training, then yes, go ahead and ask those questions. But remember, that therapist doesn't have to answer those questions. In fact, Remember, therapy is more about you than it is about the therapist, and you don't need to know all the little intimate details about your therapist in order for therapy to be effective. And when you ask questions, notice how the therapist reacts. Does that person answer you calmly and openly and readily? Or does that person seem to get a little defensive, annoyed? Do they seem to avoid your questions or give very vague answers? Well, those could all be red flags and signs that maybe that person is not the right match for you. Therapists should be willing to answer at least some of those questions. And again, they should be making an effort to be warm and accepting and non-judgmental, helping you to feel comfortable right from this initial conversation. Because this initial conversation is an indicator of what being in therapy with that person is going to be like. And I suggest talking to more than one therapist. I would say at least 3, 4, maybe even 5 different people. Well, maybe 5 is too many, but at least 3 different therapists so that you can compare and contrast, right? So you can pick and choose. Because again, effective therapy depends a lot on that match between you and your therapist. And really, this is not only you checking them out, it's also them checking you out when you do this kind of initial conversation or consultation. So you may not match with the very first therapist you talk to. Maybe you do. And this is all based on the idea that you have some choice. So if you're selecting a therapist through your insurance or if you're paying for it out of pocket, then yes, you have more control over finding a therapist that's a good fit for you. However, if you're doing something like going to a community mental health clinic or you're using one of the online sources like BetterHelp or Talkspace, they will match you with the therapist. So you don't have as much control over, who that therapist is. However, if they match you with someone and it's not a good fit, you absolutely have the right to request a change to another therapist to see if another person might be a better fit. But notice that's a request. It's not a guarantee that that is going to happen. And even if you're assigned a therapist, you can still ask these questions, these 20 questions that I just went over and shared with you in this video. Even if you're assigned, you absolutely have the right to still ask these questions so that you can get to know that therapist better and still see if that's going to be someone that you're comfortable with. Because it really is all about the match. It's about being able to form that strong professional working relationship with the therapist so that you can get the help you need, so you can improve your mental health and start living your best life. So I hope this video has been helpful. If it has, hit that like button below. As always, if you found this helpful, chances are someone else might find it helpful as well. Feel free to share it with someone else. And if you want to watch more videos about mental health issues and find more ways about living your best life, subscribe to my channel. I appreciate you watching, and I'll see you next time.